Hello. It's Thursday, March 26th. My name is Dr. Regina LaRocque. I'm a board member of Sustainable Wellesley, and I'm also an infectious disease physician and researcher at Mass General Hospital and Harvard Medical School. And I'm a natural resources commissioner in the town of Wellesley. And I have been recording these videos for the last number of days just as an opportunity to answer some questions from people in my community. And so I am going to do the same thing tonight. And I see a few things appearing at the bottom of the screen that suggest this is working. So hello. First I also want to say thanks to my fellow leadership team at Sustainable Wellesley for making this possible and getting this going. So I really appreciate it. So I actually have a list of questions in front of me, and there are some really interesting ones. I just want to start first to talk a little bit about a topic that I've been asked a lot about and thinking a lot about over the last day or two, which is the issue of personal protective equipment for healthcare workers. And I thought maybe it would be good if I talked a little bit about just what personal protective equipment is and why it's so important. So I'll just begin by saying that it's worth noting that even within my specialty, which is infectious diseases, there is a subspecialty, which is called infection control. And these are professionals who are completely focused and trained specifically on the topic of how you prevent the spread of infection within hospital settings. And it is a very important field within infectious diseases because it really provides the underpinning for everything we do in hospital systems. It allows the performance of surgeries. It allows transplantation of organs. It really is a primary basis of the functioning of a hospital, that you can prevent the spread of infection between patients, and then also importantly between patients and healthcare workers, and consequently between the hospital setting and the community. So it is a very important function of infectious diseases, and it's called infection control. So people who are experts in infection control are the ones who are really leading the charge right now in determining how we perform and use personal protective equipment in the hospital setting. And it's worth pointing out that some of this has evolved even over the course of the COVID epidemic, because we've learned more about how the virus is transmitted, and it's led to adjustments in the way that personal protective equipment is deployed. And so it's a bit of a moving target. And I just want to explain a little bit what it means to use personal protective equipment to protect yourself as a healthcare worker from an individual who's infected with coronavirus. So, so the first thing is, at this point, when somebody comes to the hospital with any kind of symptoms that could be referable in any way to coronavirus, I don't know what's happening at every hospital, but what should be happening is that these individuals are separated from the rest of the presenting members of the community, and healthcare workers who interact with people who have any symptoms that could potentially represent COVID have to don a extensive amount of personal protective equipment. That involves gloves, a gown, a mask, and goggles or eye protection. So we have to do that for every single person who comes to the hospital with any kind of symptom that's related or potentially related to coronavirus. So that means for a lot of interactions, you have to don a lot of personal protective equipment. And so if a patient is admitted to the hospital, we now have begun to have the capacity to do a test to determine if an individual has coronavirus or not. But that test takes some time to return. At this point, it's still on the order of more than a day. And in other settings, it may be longer. So during the time period when you don't know if a person has coronavirus or not, but they are suspected to, every single person who interacts with that individual has to put on and take off all of this equipment. And that has to happen every time you go into or out of the room where the individual is. And that has to continue to take place until you can confirm or exclude that the person is infected. And then if the person is infected, you have to continue to use this personal protective equipment for the duration of their hospital stay. So you can imagine that is a massive amount of personal protective equipment that is needed every time somebody goes in and out of the room, be it a nurse, a physical therapist, anybody. So I just wanted to kind of make it understood what the nature of the need is for personal protective equipment. So it is tremendous, and it is essential to protect healthcare workers. And it also is essential to protect other people who are in the hospital for other reasons, because you don't want your healthcare workers to be infected and transmitting infection to other people in the hospital setting. So it's really an essential component of being able to provide healthcare in this setting. And it was already an essential component of our ability to provide healthcare before, because we have other existing illnesses in hospitals that we have to use personal protective equipment for anyway. I think this issue of the supply of personal protective equipment has been getting appropriately some attention now, because the bottom line is that healthcare workers are already here in Boston seeing that our supply of personal protective equipment is running thin. And I think, those of us, it's hard because we don't all have access to the higher level negotiations that may be going on, but it's pretty clear that at this point it is difficult for hospital systems in the states to reliably get a flow of personal protective equipment from manufacturers, from federal supplies. There is kind of a bidding war going on between different states over essential materials. And the consequence of it is that it's an unstable supply system for healthcare workers on the front line. And so this is a very uncomfortable situation, I think, for people who are working in the hospitals, to know that there is some potential that we will run low or run out of supplies. And it's a particularly unnerving situation when we know, at least here in the Boston area, that we are really just facing that upsurge of patients, and we're seeing that now. So we know that even before we've hit the peak, we're still already experiencing some concerns about our protective equipment. So I think on the one hand, it has been amazing from what I've observed, the amount of community support and tremendous outpouring of people making donations of all kinds to the hospitals. Of course, that's fantastic, and it's very wonderful. But on the other hand, it's also concerning, the idea that having a voluntary supply is going to be needed. So I think this is why it's really important for people to be aware that there is really a tremendous need for a better supply chain to be in place to ensure that healthcare workers have access to the appropriate kind of equipment that is needed to protect both the people that are in the hospital taking care of patients, as well as patients that are in the hospital themselves. And I think that there really has been a lack of coordination on the federal level to ensure that a supply is made available. We really need a warlike mobilization of manufacturing capacity to supply all of these materials to healthcare workers. And it's really important. It leads to kind of a psychic toll for people who are having to do the work as well, which I think is not to be underestimated in its significance. So I do think it's important for everybody to be communicating with your legislators about this concern. And on the one hand, I've been really surprised to hear that people have been able to order very essential supplies through sources on the internet and have them delivered, and then donate them. But on the other hand, that's rather alarming that it's possible to kind of outcompete hospital systems for some of these essential supplies. So we need a war-like supply chain, and it needs to be coordinated from the federal level down. And so I think it's really important for us to be clear on that need. So I also want to express, I thought to myself before I started this, that I'm very thankful to everybody in our community who has been working hard to abide by the stay-at-home advisory and really to disrupt your lives in very significant ways, because I think that, the bottom line is the people that you're protecting in doing that is my family, and so I'm grateful for that. So I'm going to answer some of these questions. Do you know of any collaborative efforts in the medical community between states that might not be public knowledge yet to prepare for the next hotbed? I feel abandoned by the federal leadership and the leadership in my state of Florida. Well, first I'll acknowledge that this is coming from my family who's in Florida. So I guess I want to say a few things that I'm thinking about as I look at this question. I mean, one, it's really important to recognize that we are all connected in this epidemic. What is happening here in Boston cannot be separated from what is happening in New York, and will not be separated from what happens across the rest of the country, because we travel, and we know that, frankly, there's a raging epidemic in New York City right now, but certainly there were people who left New York City within the last week or two and who are in Boston and traveled around the country. And so we are all connected, and we are only as strong as our weakest link in all of this. So what happens in New York is really going to be happening in other places too. And the only way that could change, it can't change at this point. The only places that could still be kind of escaping from that reality would be, an island somewhere. So we are all connected. So the question regarding collaborative efforts in the medical community, I guess I want to say that I think that, the coronavirus has arrived in the United States, and I think our medical community is mobilizing in an incredible way. We have professional societies, we have formal and informal connections, we have journals like the New England Journal that have really just focused their attention on this, and there is a lot of communication going on between clinicians in different states, rapidly trying to scale up the knowledge that we have about how to treat patients. And we have rapidly put in place some clinical trials to do tests to really evaluate what is the most effective treatment for this in a appropriately rigorous way. So, I think the answer to that is yes. There's a lot of knowledge that we need to gain, and we have here the kind of medical research capacity to apply to this problem. And so I will say, yes, there's a lot of communication going on amongst the medical community. We're learning more every day. So that is, I think, encouraging. As far as preparing for the next hotbed, I mean, I think that the next hotbed is everywhere, and I think we all need to acknowledge that when large cities are affected in the way that we're already seeing, that it's spread throughout the country. And I do have concern, frankly, for communities that are not served by institutions with a lot of experience and capacity in infection control. And it's challenging even for large institutions like our own to keep up with this. So it's going to be a big challenge for smaller community hospitals. So I think the landscape of what this looks like in other places like Florida is going to be different than it is here in places like Boston and New York. Can you tell us anything about research into treating COVID-19 by separating antibodies from previously infected people's plasma to be used to help treat currently ill people? Well, I think maybe I should just say a word about treatment, and it's a good question. I mean, if you look back over the history of infectious diseases, convalescent serum from people who have recovered from illness has been used in the past many times to treat infectious diseases. And I know that it's not something I'm involved with, but I have seen reports of people who are beginning to look at this. And of course, we should look at this because this is one of our kind of fundamental tools for treating people with infections when we don't have any other treatment, to just take antibodies from people who've recovered and put them into people who are sick. So there definitely will be work on that front. And then I think that it is definitely underway now, clinical trials for some of the potential treatments for COVID that are being considered. So those are now already underway at our academic institutions. Really people quickly stood up the capacity to do these studies, and they're happening now. So these will be the ways that we learn what are the most effective treatments for this. So in some senses, that's why I say, this infection has hit Boston, and the Boston infectious disease community is hitting it back with everything we have. And that most importantly includes studies of what are effective treatments. I know there's a lot of talk out there about potential treatments, and at this point, it's just important to know that that is all talk, and it really is important in the medical world to apply some study technique to treatments so that if something works or not. And this is important because you can waste a lot of time and resources on things that are not effective, and that's not what you want to be doing. Governor Baker, have you had any response to the specific requests in the letter that you and your colleagues sent to Governor Baker? So actually, I will say more than 1,000 people ended up signing that letter, and I believe it wasn't me who was in charge of it all. So I believe it was delivered to the governor, and I believe he may have made a comment about the concerns about personal protective equipment during his press conference. But we rarely get specific answers to letters like that, so I don't know. I will say that, I hear from him also the frustration with the supply chain for protective equipment, and I think that I'm sure he is working, within his capacity to push for those things. I think it would be helpful to, have the public understand the issue, that we really need the Defense Production Act to be used for this purpose. I think the marketplace is not really effectively the way to ensure the supplies that we need here. Governor Baker ordered a stop to all non-essential work, but I keep seeing lawn care crews in my neighborhood. This is confusing. Do you think this is safe for the workers and the neighbors? I think this is a really interesting question and important question because it really gets to the issue of what when you ask people to stay at home, it's a big burden on people to do that, and it's kind of a well-known thing, I believe, in the public health world that you can't impose quarantine or restrictions on people without having in place a way to make it possible for them to have their livelihood and to to sustain themselves through that. So that's where we get into trouble when we haven't put that kind of system proactively in place ahead of time. So it's not fair for the burden of this quarantine, this stay at home, to fall on people for whom it will be a financially devastating event. So, my biggest concern in seeing that is, what's happening to the workers. I do think that it's very difficult to maintain social distancing in any kind of work setting. So I worry about their exposures. And I worry that they, you need to make your income somehow. So if we haven't put in place a way for them to earn their money to support themselves, then that's problematic. But I will just make the point that I made before, which is that we are facing an epidemic which is frightening. And every day that we wait to really activate all the public health tools we have is a day lost and represents more deaths. And so we just have to be honest about what trade-off we are making here. And I think from a health perspective, it is at this point in the game, reckless to be allowing people to continue to engage in the types of interactions that we know are transmitting the virus, because we are only as strong as the weakest link in our transmission chain. And so we'll see. So, we'll see. I think that other states have taken much more aggressive measures, and I'm sure we're gonna find ourselves in that position soon enough. And the issue is that the longer you wait to take the aggressive measures, the less effective they are. I've heard there's a shortage in the blood supply. I'm not aware of a shortage in the blood supply. I do think it's a good idea to be donating blood in general when there's an emergency. I think what's problematic right now is you really don't want people going to the hospital for anything unnecessary. And so I guess I would just refer you to whatever given hospital you're associated with is asking. Testing. When will testing become more readily available in Massachusetts? Yeah, this is a really important question, and I've been thinking about this a little bit more over the last day or two, kind of how to explain to people the issue with regard to testing. And I want to just say that it's important to recognize that we went into this epidemic without having widespread testing available. And that's just a fact. We did not have capacity or infrastructure to do kind of widespread community surveillance for coronavirus prospectively. And so consequently, it was able to sneak in and start spreading. And now, more recently, the issue was that as patients were beginning to appear, we didn't even have testing in that setting to identify people who had coronavirus who were coming to health centers. I think at this point in the last couple of days, we have ramped up our capacity to do testing within hospital settings around Boston. And it's going to shortly be the case that having access to tests is not going to be as limiting a factor as it has been in the past. But I think an important kind of piece to understand about this testing issue is that, even once we kind of stand up a diagnostic capacity within the state, and that's coming, there is going to be a second wave of issues related to that, which is how do you use those diagnostic tests? In what setting, who applies them, what do we do with the results? I mean, diagnostic testing is going to need to be a really essential part of the containment strategy that needs to be developed next. And that is where we are going to have to go here. Once you have, I just think once we've ridden out the tidal wave of cases that are going to be coming, we're going to have to figure out a way to develop a really strong public health response to contain this. And that is going to be based upon a lot of diagnostic testing. But perhaps the more complicated piece of it is just the logistics of rolling out a public health surveillance system and containment strategy. And that really is just your need, I would say, for us to develop within our state and our country a public health infrastructure system that we really don't have. We have, as I think I talked about in one of these previous questions, we have very excellent, and not for everybody, but we have very excellent advanced medical care, but our kind of fundamental public health infrastructure has been overstretched for a long time. And so that is the weakness that is being revealed here with this epidemic. And so we're going to need to kind of stand up a public health system that we will need to have within our communities, within our states, to use diagnostic tests in a way to contain the virus. And I mean, that's almost as big a logistical hurdle as getting a diagnostic test up and running too. So I just want to make that point. I mean, we need a bailout for the public health system, and that is, that's what's coming next, I think, as a challenge. On the local level, what should cities and towns be doing to prepare for the tsunami that we know is coming? Well, I think that preparation is best done before the tsunami hits. And I think there's a lot that we are doing now that we have kind of, I think as human beings, we have an inherent inability to understand a threat until it is immediately before us. And, I do believe that is something that we've seen play out here. It's been kind of hard to conceptualize that this was coming. And now I think everybody's fully aware of the nature of what, or I hope are fully aware of the nature of what we are all facing here. So I think in that sense, we are kind of preparing at the same time as we are also responding to the tsunami. And that's a tough spot to be in. I think that it's also important to recognize that we have a tendency to want to, as human beings, kind of anchor on the most optimistic scenario. And I think realistically, I think that we're going to be better served if we think about what the worst case scenario is. And, the worst case scenario here is pretty bad because it involves many people dying, many people requiring intensive care to a degree that we won't be able to provide all of that. And if you look at, for instance, what's happening in Spain, and some really horrible things of, ice skating rinks having to be turned into morgues. So, if you imagine that and plan for that as a town, that's probably a good thing to do. What does it look like to have 600 people in your community die unexpectedly over the course of a couple of weeks? What preparations would you want to have in place for that? I look at my own community here, Wellesley, which has 30,000 people. And so, even if the case fatality rate is 1 or 2%, that's still 300 or 600 people dead in short order. So, I'm certainly hopeful that the measures we've taken here, which were taken, I think, very with real urgency by the community, that's going to, I hope, stand us in good stead. But it's important to recognize we are all connected. And so, it's not just what we've done in our own town, it's what our neighbors are doing in their town. And it's what is happening in the state next door. And it's what's happening in the other side of the country. So to some degree, you can't wall yourself off from what other communities may have failed to do with urgency also. So I think those are the questions that I saw for tonight. I just wanted to give one last reflection that I've been thinking about a lot, which is just the fundamental fact that this is a time when we are facing really, a political crisis too, because I think that what is transpiring here is a health emergency, but it's a health emergency that is existing within a political context. And it's just important to remember that it is our political leaders who are going to be determining the response that our communities and our state and our country take to this epidemic. And I think that what determines that response is going to affect a lot of people's lives, and there's going to be trade-offs that will have to be made, trade-offs between economic impacts and who lives and who dies, and how we respond. And I think that if I think about this, I will want to know what values are being applied to the decision making and what trade-offs are being made. I'd like to think about those things explicitly. I think about, for instance, with our own advisory here in Massachusetts, it's been accepted to do construction work. It's been accepted to do lawn care. So that's a trade-off, right? That allowing those activities to proceed is a trade-off with the potential that is going to feed into the epidemic, right? But let's just acknowledge what those trade-offs are and be explicit about them. I think that's important. And I think it's also important to recognize that healthcare workers are going to be the ones who are going to be at the front line of some of those trade-offs in terms of their lives. And also, certain people in our community are going to suffer more with this than others, and we've seen that already. People who live in congregate settings and can't leave, so people in nursing homes, people in prisons, immigrant communities where they may not have access to the information about what's happening, where people might be living in high density housing situations. These are communities that are going to be more vulnerable. And so let's just be explicit about whose value systems, what value systems are being applied, and what trade-offs are being made. And I think these are conversations that we all should have and should understand. And my plea has been that if we as a society are going to accept that people will die from this, and that it may be a lot of people who will die from this, then you have to protect your healthcare workers in that setting. You have to say, yes, we know people are going to die. We've accepted that. We're not going to be able to stop that from happening, and we're not going to take measures to stop that from happening. But if that's the decision we're making as a society, then we need to ensure that healthcare workers have all the protective equipment they need to do their best. And we also need to understand the psychic toll that is going to have on some of us too. Because I think we all know, and we are all preparing for what is going to be some very difficult scenarios. And our professional societies are busily developing guidelines about, who you put on a ventilator and who you don't, who you remove from a ventilator so that you can give it to somebody else. These are things that are hard to kind of get your head around. But it's coming, and we know that. And so, okay, I think I'm going to take one last question and then I'll wrap up. Is it helpful for people to continue to make masks for healthcare workers? Yeah, I've been asked this too, and I don't think that making masks has any particular value. It certainly doesn't have any value for healthcare workers. I mean, I think, as I said before, I don't have an objection if somebody in the community wants to wear a mask, a handmade cloth mask. But I think for a healthcare worker, that is not the standard of what we expect for infection control settings. And that is why I feel alarmed that we are having to have that conversation about whether we should have homemade masks. I think it's kind of the analogy of you wouldn't send your soldiers out to war with some toothpicks. So I guess that's my answer to that one. So I'll stop, and I just also want to say again, I'm really grateful to people who have been adhering to the stay-at-home advisory, and I also want to underscore that these comments are really just my own personal opinion and experience that I'm offering as a community member and a member of the board of Sustainable Wellesley. And I think it is really important to seek out reliable, accurate sources of information. So that includes the CDC website, the Massachusetts Department of Public Health, the Wellesley Town website. And I've said it before, but the New York Times reporting on this epidemic, to my mind, has been spot on with the on-the-ground experience. And the Boston Globe has been doing a good job recently with just covering what's happening here in Boston. So those are all places to get information. So I'll just say thank you very much, and I appreciated the chance to talk with you all tonight. It's kind of therapeutic for me in a way. I'll just say, to kind of process what's happened over the course of the day. And so I will also express my gratitude to whoever is watching.